We announced the launch of the Obesity Association, which is now going to be a division of the American Diabetes Association.
Welcome back to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster, here on the floor of the American Diabetes Association annual conference, the scientific sessions, and I'm here with Chuck Henderson, the CEO of the ADA. Chuck, great to see you.
Logan, thank you. It's always great to see you.
You are a busy guy. You have been everywhere, including on the main stage giving your opening remarks. I want to take this moment to just get some highlights around your priorities. Kind of what did you share with the folks yesterday?
Yeah, we had a great turnout. I think the auditorium or the convention center was absolutely packed in the room at the opening. So I'm always very grateful to all of our volunteers, all of our supporters, all of our partners. That attend is very meaningful to me, and it's also very meaningful to people living with diabetes. But some of the really exciting things that we shared was all kind of the new cutting edge research that's actually coming out, and also we announced the launch of the Obesity Association, which is now going to be a division of the American Diabetes Association. And so obviously, obesity, has always been a long-term issue in this country. And so as it relates to diabetes and obesity, we've always talked about it, but now we're double downing on it, and we're going to amplify it even more to where it's actually going to be very heavily integrated into our standards of care. And as you know, our standards of care, essentially that's one of our greatest assets at the ADA, almost like the holy grail of all things diabetes. And now we're going to add, a very important chronic disease now in obesity, and add that, to all the comprehensive things that we have in our standards of care.
Just last night, I was having dinner with somebody, and they had heard your remarks about that, and they said, this is going to work. And they were very excited. And they specifically talked about those standards. And they said the ADA has been so strong on standards, and those have been lacking in some other specialty areas. And so I'm excited about that. Give us a few more details. What does that mean functionally? A conference? How are you going to bring that community together?
Yeah, so we've already made outreach to some of the obesity societies and different organizations that actually focus on obesity, and so we really I always say it takes a village. Right, and it's going to take all of us to actually come together to solve this issue. It's not something that we can take on by ourselves. We need other people, we need other partners, we need other supporters. And so I'm also happy to say that we're going to invest infrastructure into this, right? And so we understand that, because we're taking on this big issue, it needs investment, it needs experts. And so we're going to integrate this into the ADA ways of working as an organization.
In my experience, a lot of the most interesting conversations you have at a conference like this are in the hallways, in the side rooms, not necessarily on the main stages. Sometimes it's an offhand conversation that you have while you're waiting for food with somebody. Anything come to mind that's kind of piqued your interest, gotten you excited, made you feel optimistic about the future?
Yeah, so I would say not anything that's piqued my interest, but health equity. Every hallway I walk down, every room I walk into, everybody's talking about health equity and equality for all. And we've actually launched our health equity platform a couple of years ago, right? And so, we've actually made an investment as an organization. We have an Office of Health Equity, started with one person. Now we have 10 people in that group now. And so everything that we do as an organization, it has to have a lens of health equity. Everything, right? Because again, everybody has a right, right, to have access to the same available healthcare resources. And so when we think about coming up with programmatic things, we're going to lead with health equity, right? How does this, not only underserved, how does this impact rural communities, right? How does this impact global communities, right? And so, but at its core, it's going to be about health equity.
Can you give me an example of where you'd like to see that directed? It's one of those interesting areas because it is foundational to everything, and yet it kind of helps people understand when you think about specific programs. You mentioned rural. Any particular ideas?
Yeah, so not necessarily a particular idea, but I can kind of talk about a current program. Okay. So one of our partners partners, Genentech specializes in they have a drug that specializes in diabetic retinopathy, right? And so we're currently running a pilot in Birmingham, Alabama, to actually, go into the community, build those trusted partnerships, and we're partnering with UAB Health System, and so we are getting to people early that have eye issues, that have unmanaged diabetes, and we're getting them. We have mobile clinics, mobile screenings, and so we're actually getting them into ophthalmologists. Once they get into the ophthalmologist, then they'll be able to see, different specialists and get on that treatment immediately to actually save their eyesight. So that's the kind of transformational impact that you're making when you're talking about health. And it's not just in the city of Birmingham, it's also in rural Alabama as well for those people that, again, lack of access. So now we're taking mobile vans, mobile trucks into the community and addressing the unmet need.
Okay. One thing interesting about the ADA conference is that you've got lots of big enterprise legacy players, and you've got the Innovation Challenge and your early stage startups, and you're on the impact board for Startup Health, and so you see some of that early stuff. I'm curious what your experience has been like being on that impact board, meeting some of those founders, and sort of starting to connect the dots between early stage innovation and the bigger players that are working at scale.
Yeah, so, one of our programs is our Pathways programs. And so we actually get to early stage researchers early, that may not qualify for that, for a certain type of a grant. And so our Pathways program actually fills in that gap and fills in that unmet need. So to your question, I love disruption. Right? Disruption in a positive way. So there are companies that are great companies that have been doing great work for a long time, but you also need that disruption so that we can push different organizations to think a bit differently. So, I like the balance in between the early stages and the young professionals and the young thinkers and the young innovators and the young early stage companies, because I think that competition is always good and all boats rise. And at the end of the day, it's all about people living with diabetes.
I know you were a pro athlete, played basketball. Does that sense of competition come a little bit from your past?
Oh, I love competition. I think competition is good. I think competition pushes everybody to be the best that they can be. Yes.
I love it. Chuck, keep up the great work. Thanks for taking a moment with us out of your very busy schedule. I appreciate the help you've already given in the Diabetes Moonshot that we do and in the other work and with the Innovation Challenge. So I appreciate you. Any last words?
No, just last words. I'm always very appreciative. This is our second or third interview, and I appreciate everything that Startup Health does in terms of bringing people in communities together. Obviously, I'm a board advisor, and I look forward to making a contribution to what Startup Health is trying to do from an ecosystem standpoint, and really trying to solve these chronic illnesses by addressing several different moonshots.
Love it, Chuck. Thank you. All right.